Well, hello, everybody. This is Dr. Moses Dixon, President CEO of Senior Connection, formerly the Central Massachusetts Agency on Aging. And today we have a very special guest who's been a strong supporter of Senior Connection over the last 2 years, Joan McGrath from the Special Needs Trust Plan of Massachusetts and Rhode Island to talk about our work that we've done over the last few years and just to hear a little bit more about Joan's background as well as the work that the organization is doing. And so, Joan, I want to take time to welcome you for taking time to join us here today. So thank you for joining us.
Thank you.
And Joan, could you give a little bit about your background and the organization that you run?
Sure. I started out life in public accounting. I worked for Deloitte. I then started my own practice, and Plan of Massachusetts and Rhode Island was one of my clients. So I started there in 2009. So I am almost 16 years with them. And it was one of those opportunities for me that life changing, really.
Yeah.
I got to use my skills in finance and accounting. I was the director of finance when they brought me in. And then I was appointed executive director in 2020.
Yeah.
I had to think about that. So Plan itself has been around since the 1960s. It was late 1960s. A group of parents got together trying to figure out ways to advocate for their children with special needs. In 1971, we were incorporated, and we offered special needs trust to everybody.
Yeah.
In 1993, the OBRA Omnibus Reconciliation Act passed, and that allowed anybody to set up a special needs trust using their own money or that of a donor.
Wow.
So what came about in 1993 was something called the pool trust. And a pool trust allows anybody of any age, any disability, and any amount of money to set up a trust. Having that ability to do that allowed people to start living a quality of life. And many people over 65 took advantage of that up until March 1st. That's when that went away in the state of Massachusetts.
Yeah, and so very interesting background and how you sort of segued into the work and being ahead of the plan of MA in Rhode Island. You and I connected a little over 2 years ago because I was very intrigued by the work that the organization does, particularly with the older adults that we service here in central Massachusetts. And then obviously now with this new population that we're serving, grandparents that are raising their grandchildren. And Joan, I will tell you, over the last year and a half since the Resource Center for the grandparents raising grandchildren have gotten off the ground, we've come across a lot of these families that have children with autisms or other developmental disabilities, and particularly from Black and Brown communities. So can you talk a little bit about, how, the work that the Plan of MA in Rhode Island does and how you basically specialize plans for minors and children that has special needs and sort of the outreach and particularly in communities that don't speak English as well and how you've reached out to these communities, and certainly you have done that with partnering with organizations like us to get the word out.
It's really important to reach everybody in the state of Massachusetts. To Autism affects everybody. It doesn't matter what your economic situation is. It affects everybody. Plan is in a really unique situation in that over the last 50 years, we were able to put some money aside. And by doing that, it's allowed us to give grants to organizations. We also work with AA&E, Autism Asperger's Network. And this effort to reach everybody in the state. We work with people in Massachusetts and Rhode Island, but to work with anybody, often what comes to us are families, grandparents that, they might have 7, 10 grandchildren, and one of those children is autistic. What do? Yeah. They don't want to leave that child out. And that used to be the recommendation, was to not leave anything for that child. But grandparents now can set up a trust, so when they pass away, all that they put aside throughout their life can then go to a third-party special needs trust for that child. They can divide it between typical and non-typical. They can, as long as they're planning and they want to show that they care for that person. Yeah. It's such a great opportunity. And the idea that you don't have to have millions of dollars to do this. You might have, you have your house, or you have some small assets, you have a 401k, something put aside, and you can still use that to fund a trust when you work with a pool trust.
Yeah, that's very fascinating. And again, before I came across the organization, when we connect, I never heard of any sort of focus and planning on, this population in particular. And you mentioned kind of briefly in your introduction about some of the challenges in regards to policy and legislation that is sort of become sort of a hurdle to continue to do the work that you guys do. Can you talk a little bit about that, and then give your perspective on, what can we do in the community to continue to support the work that you guys do, whether from an advocacy standpoint, whether it's from reaching out to our legislators. Just talk a little bit about some of the challenges.
So for special needs trusts, you could have federally, you're allowed to have a special needs trust at any age. So imagine you're 68, going to work, you're in an accident, and you need some sort of care, long-term care, some sort of care. If you are over the age of 65, you are no longer allowed to set up a special needs trust. Wow. That is discrimination. That is age discrimination. You can in Rhode Island, but you can't in Massachusetts. Wow. And you were allowed to do that for 30 years in Massachusetts. But as of March 1st, they took away the ability to do that. So there is legislation pending. There is a pool trust bill. It's also included in the long-term care bill, 4178, I think House 4178. It passed overwhelmingly. I think it was unanimously, actually, in the Senate. I'm not sure about the House, but it passed unanimously last year in the House and the Senate, and it was vetoed by Governor Baker. Again, it passed the House and the Senate this year, and it never made it out of committee. They passed 3 out of the 12 that were ready to go. So what I'm asking, and there's advocacy groups that are putting this together, that people reach out to their senators, their reps, and say, get this passed. Yeah. It's the long-term care bill, and it is for seniors. Yeah. It is to make sure that there's some oversight and protection for seniors. Yeah. So I would strongly suggest people reach out. And it's organizations like yours and mine that can get together with other organizations and try and push this forward. Yeah.
So was there any rationale as to why, as of March 1st, that they just basically took that away?
So the fear was, which was unfounded, the fear was that what they're trying to instill in people is the fear that we'd lose federal funding. That has not happened in any state in the country. Nowhere has that happened. And I can't imagine telling people that you now will be discriminated against, and if you push it, we're going to take away the federal funding. Yeah. That's never happened. So we feel pretty strongly. In DC, you can do this. You can do this in Rhode Island. I think there's 17 states in the country that you can do this. And then there's other states such as Colorado, Kansas, where you can set up a special needs trust over the age of 65, and you need to show that there's value to it. Yeah. And that is what we also have here. You need to show value, and there is value.
Yeah. And to that point of over the age of 65, I mean, look, older adults are living longer because of better health care,
Working longer.
particularly in Massachusetts, where we have, in my opinion, the best health care in the country. And what comes along with that is longevity,
Yes.
if you will. So could you give the number of the bill that is sort of pending that you need people to push their legislators on?
Yes.
Um,
There's so many bills
yeah,
and getting them
yeah.
confused, but I think it's
What's the name of
the long-term care
the
bill.
long-term care
Bill.
bill
Yep.
in the Massachusetts State House? Um, so staying in line with the special needs trust, could you talk a little bit about, once, a minor or an older adult who's 65 or older has a trust set up,
Yes.
right? Um, what is the role of a trustee? Who is a trustee? How is that managed? Because I've seen in a lot of situations, particularly dealing with the older adults here in Central Mass, where some of them may have a trust or somebody that's overseeing it. How does your organization ensure that once the trustee is instilled, that they're going to live up to whatever's been put in the trust?
So we're different than most trustees. So you can set up a trust at any age. Once you hit 65, you're not allowed to in Massachusetts. But prior to that, if you set up a trust and you are looking, you can have a family member could be a trustee. You could have a bank be a trustee. You could have an attorney be a trustee, or you can have an organization like mine be a trustee. There's actually 4 nonprofit organizations in this state that do this. So we have 850 beneficiaries, and typically people come to us when, I'll give an example. We have a person that comes to us and the parents are planning for when they're gone.
Yeah.
And they're thinking, oh, I'm going to have my daughter be the trustee for her brother.
Yeah.
Well, the daughter now wants to get married and move to California, and she doesn't feel like she has the skill set to be able to do that. So you could go to a bank, but a bank will require usually over $1 million, and they charge 1.25% for the investment of funds and the trustee. Plan is this nonprofit organization that we've been around for over 50 years. We employ social workers, and social workers work with each beneficiary to make sure that they use the trust and that they do not make disbursements from the trust that would impact their eligibility for public benefits.
Yeah.
And that's really the key. You want that public benefits so that you can live a quality of life.
Yeah.
The cost for comparable services without public benefits is astronomical.
Yeah.
And you can't even get into some programs unless you are on, Medicaid.
Yeah.
So it doesn't make sense not to be on Medicaid. So in order to be on Medicaid, you can't have more than $2,000 of your own assets in an account. But if you set up a trust, a special needs trust, you can have any amount of money in there.
Wow.
So that can be used to supplement so you go into a nursing care facility, Medicaid will pay for a room. You can use your personal funds to get a private room. Yeah. You can get dentures, eyeglasses, all sorts of things that Medicaid won't pay for. You can use your special needs trust. You can fly your power of attorney in from wherever they live to come in and visit you and look at your situation once a year. Or you can use that to go visit your grandchildren. You can use your special needs trust. For younger children, they're on their parents' benefits, typically till they're 26. But if you set up a special needs trust for your grandchild, once they transition to 22 or older, they now are on adult benefits.
Yeah.
Yeah. So you just want to you want to plan carefully. We work with a lot of attorneys that can help you set up a trust, and Plan will do whatever we can to support you. As I said, we don't have a minimum to set up a trust. So we'll work with you to preserve your assets and hopefully have a quality of life. And that's really the focus.
And that's so important, not having a minimum to start a trust.
Yes.
And I know particularly, we have the community health workers that work with grandparents that are raising their grandchildren. You guys have social workers. that work with these families to set up these trusts. And it is, how are you sort of getting the jargon out of the way to explain to these families what you just explained about not having a minimum to start? Because a lot of these families that we work with, and even some of the older adults who are 65 plus, when you think about a trust, you automatically think, I've got to have a certain amount of money
Right.
to start a trust. So
Right.
how are you conveying that from the beginning to these families to say, hey, you don't need to have $1 million to start this trust?
Let's say there's some sort of a settlement. There's some sort of they came into money that they didn't have before. You could have as so we don't recommend anything less than $10,000. If you put the money into trust, say you have 20,000, you put it in, that gets invested. When the money's invested, it earns money. One of the things you said to me, you had never heard of us before,
Yeah.
and that's our biggest challenge.
Yeah.
We've been around for 50 years and no one's ever heard
Yeah.
of us. But we offer, because we don't market. We're not out there telling people. We're trying now, and the way we're doing that is by partnering with organizations like yours, so people know that they have options for special needs trusts. The social workers are instrumental in being able to convey our message to the person. Um, if it's the person themselves who has the disability, our social workers are trained to work with any disability.
Yeah.
Brain injury, there's a lot of things that happen to a person as they age.
Yeah.
And social workers are skilled at working
Yeah.
with people. You're not going to get that
Yeah.
at a bank. And back in the office, we do all of the necessary work for the tax returns that you're required to file, follow any of the rules related to whatever disability you're in. And the social workers will help you find benefits that you're entitled to be on.
Yeah.
And make sure that you get on those.
Yeah.
So we try very hard to
Yeah.
connect with the population.
Yeah, no, that's very important. Um, so one of the other lingering questions is, you mentioned that you have the social workers that work with these families to set up these trusts. Are there situations where a family who has been had the trust for a number of years and then they decide they want to not, so once a person have a trust, can they not have a trust anymore? Can they just say we want to do something else? Or is it, once you're in the trust, you're in the trust?
So the trust is irrevocable,
Yeah.
which means if it wasn't irrevocable, meaning you can't end the trust.
Yeah.
If it wasn't irrevocable, it wouldn't be allowed as a special needs trust.
Yeah.
That's what makes it so that they don't count it against you.
Yeah.
So you have an elderly couple and they have, $50,000. They want to leave it for their grandchild. They can put it into a trust. Well, upon their death.
Yeah.
They don't want to do that before, obviously,
Yeah.
because they need to take care of themselves.
Yeah.
But they want to make sure that their child is taken care of once they're gone.
Yeah.
So they can arrange to have that trust funded. So then it's invested. Last year, which was a really good year for us, we had a return of 11% on the, which is unheard of, really.
Wow.
It was an amazing return. What we're trying to do is make sure the money's invested to cover any fees related to that. Once the trust drops below a certain amount, plan, I think it's $40,000. Anything below $40,000, plan does a minimum fee reimbursement, meaning you will never pay more than the minimum fee.
Yeah.
We also do grants for people. It's usually $10,000 for someone that if they're running out of money, but they need something, we do what we can to make sure
Yeah.
that the person can get, furniture for their apartment or
Yeah.
whatever it is. So it is irrevocable, meaning it can't be ended.
Yeah.
But we can work with the person
Yeah.
to spend the money.
Yeah.
There's something called an ABLE account. So if a person was diagnosed before the age of 26, the money from the trust can be used to fund the
Wow.
ABLE account. And then the ABLE account can be used to pay for whatever the person wants it,
Wow. Wow.
as long as it's disability related.
So, just staying on that topic a little bit there. So, you have a family that comes in and they have a kid who's 4 or 5 and who's on the spectrum, right? How do you determine if they qualify? Like, what is the qualifications for someone to actually get signed up with the trust? What are type of documentation you may need? Like, what is the process? Because someone can't just come to your organization and say, I want to set up a special needs trust. There needs to be some sort of checklist, I would imagine.
Right. So they have to fill out an application telling us that there is a disability. The disability must be documented if it's an SSI, if they're looking to get on SSI, Social Security insurance or something.
Yeah.
But a child that's 3 or 4 is going to be on the insurance of whoever the parent is or grandparent, whoever's caring for that child. So what the grandparent wants to do is set up something called the future funded trust. There's no Medicaid payback. So if you have a third party future funded trust, once that trust is funded and it's a third party, there's no Medicaid payback. If it's a first party trust, then there is a Medicaid payback upon the death of the beneficiary. So it's super important that they do their planning. If they come to us and they're looking for some information about how to do it, we can give them the name. You don't need an attorney to set up this trust, but because it's a legal document and it's irrevocable, we really suggest strongly that people meet with attorneys that specialize in this. A colleague of mine always says you wouldn't go to a foot doctor if you were having dental issues. It's the same. You need to go to a specialist in special needs lawyers.
No, Joan, this has been very helpful. I obviously have known all about the organization through our partnership, but learned so much more here today. Is there anything that if there's families or individuals out there that want to learn more about the Planned Special Needs Trust of Massachusetts and Rhode Island, where should they go to get more information about the process, and whom should they contact?
So we have a great website, I've been told. People really like our website, www.planofma-ri.org. But you can also call our office, and we have a wonderful woman who her name is Tiana, and she does all of the enrollment work, but we don't charge. So you can call as many times and ask as many questions as you want. We're happy to take time and have a consultation with you. You might get me on the phone. It'll start out with Tiana, but we encourage people to learn what their options are. Because there are options. So. Yeah.
That's great. Well, Joan, I want to thank you for taking time to come and really share about the great work that you guys are doing. And we look forward to continuing to partner with you and your organization in the years to come. And thank you to everybody for joining in on this episode of Aging Well Together. It's been great hosting Joan, and we look forward to hosting another podcast soon. And as I always say, it doesn't matter if you're 5 years old or 55 years old. We all age well together. So thank you for tuning in.